A thorough physical examination is essential before establishing a successful physical therapy regimen. A key element is the special physiotherapeutic examination besides the standard orthopedic and neurological examinations. We will now focus on specific physiotherapeutic elements. The therapist should examine the patient at a stance, at different gaits, and during specific movement activities. Weight bearing on the limbs. Often there is less weight placed on the lame limb at a stance. Flexion and extension of the joints. Weakness and trembling. Is the line of the back physiological or not, like kyphosis or scoliosis? Head position. A stiff head-neck position can, for example, hint to cervical disc lesions or the wobbler syndrome. And finally, body conformation. Muscle asymmetry can indicate muscle atrophy or swelling. Is the animal able to sit down, lay down, and rise to a stance? While sitting down or laying down, one pays attention to a smooth flexion of all involved joints. Pay close attention to the hind limbs while the animal gets back up. Does the animal have difficulty to place weight on the hind limbs? Is it difficult to transmit the weight to the front limbs? The gait is assessed while walking and trotting, while the patient is on a short leash, and while the animal is moving freely. The examiner should assess the gait on different types of terrain if possible. The patient should be observed from all sides, for example from the front and the back, right and left. One should observe posture during gait. The line of the back. Does the back swing freely in motion? Is lateral flexion of the spinal column increased or reduced? Is there more lateral flexion to one side or the other? Can any peculiar head, neck, or pelvic movements be detected? How is the tail position? Lameness is evaluated according to the standard lameness classification schemes. In addition to assessing the severity of lameness and classifying the condition as supporting leg lameness, swinging limb lameness, or a mixed form of lameness, special attention should be paid to the following criteria. Joint flexion and extension during the stance and swing phases of the gait cycle. Stride length. Foot position during the weight-bearing phase, under the body, lateral. Dragging of the feet. Proprioceptive deficits. The patient should always be walked and trotted in large circles, but also in sharp turns if possible. The above lameness assessment criteria should also be evaluated during turns. Turns are helpful in uncovering subtle signs of lameness or neurological deficits because the inner limbs receive more of the weight-bearing forces than the outer limbs. The limbs and spinal column are carefully palpated to assess their symmetry and general muscle condition, that is, to assess for muscle atrophy. Using both hands, each pair of limbs is palpated simultaneously to determine whether there are any differences between the two limbs. The examiner should proceed from the forelimbs to the hind limbs and then assess the muscles of the back. The following criteria are assessed: general muscle condition, muscle symmetry, muscle and joint temperature, swelling or hardening of joints or muscles, muscle tone. The examiner should begin by palpating the dorsal aspects of the scapulae to determine whether the two sides are symmetrical. Next, the shoulder blades are palpated and the condition of the scapular muscles is assessed. After assessing the scapula, the examiner should grasp a limb in each hand and palpate it from proximal to distal, starting at the shoulder joint, then arm, elbow joint, antebrachium, and finally the carpus. which is the European way, or from distal to proximal being the American way to do this procedure. The hind limbs are assessed in a similar way. This assessment starts in the pelvic region, beginning with the gluteal muscles. Next, the thighs and the lower leg muscles are palpated from cranial to caudal. Whereas in Europe we start at the hip area, the US and other countries start this routine from the distal part of the limb. In order to assess the back muscles, place the open hands flat on the back to the left and the right of the spinal column and palpate cranial to caudal from the neck to the tail. The object is to assess the general condition, symmetry, tenseness, pain, and temperature of the back muscles. There are further special diagnostic tests to evaluate the back. The skin fold rolling test is performed at the beginning of the examination procedure and provides important information regarding tension and problem areas in the muscles. Grasp a roll of skin in the sacral region between the thumb and the index finger of each hand. Now displace the skin fold in a caudal to cranial direction with the hands positioned lateral to the spinal column. In the presence of muscle tension and/or pain, it is difficult to lift a roll of skin from the deeper underlying structures. This increased skin tautness is caused by altered connective tissue turgor and increased muscle tone. Palpation of painful points. Starting at the neck, press the thumbs into the muscles left and right of the spine, gently at first, then gradually increase the pressure. Next, slide the thumbs downward, caudally, roughly the width of a vertebral body, and repeat. For detecting reduced spinal mobility as well as for treating vertebral blockades, the spinal process maneuver can be performed. The spinous processes of the vertebrae are grasped between the thumb and the index finger or between the thumb and middle finger and are displaced in the vertical and horizontal planes with gentle vibrating movements. Stroking is a superficial tissue manipulation technique at the beginning of a massage session. As a rule, stroking movements are made in the direction of hair growth. Stand beside or behind the patient and place the open hands flat on the muscles, starting from the neck. Stroke the muscles gently and not too rapidly, proceeding from the neck, down the back, and to the croup and hind legs. Grasp each leg with one hand and glide the hands downward. After reaching the feet, start stroking again from neck to feet. It is important to maintain physical contact with the animal when moving from one part of the body to another. Stroking is normally carried out with the animal standing, but can also be used in a recumbent patient. When kneading superficially, a roll of skin and subcutaneous tissue is gently grasped, thereby raising it from the lower tissue structures. Kneading gently stretches and mobilizes the skin. After grasping the roll of skin, release and slide the hands forward to the next segment, then grasp another roll of skin. To treat the back, place one hand on either side of the back or place both hands on the same side. Knead in the direction of the muscle fibers in the first case and opposite to the fiber direction in the second. Proceed from tail to head when treating the back and from distal to proximal when treating the limbs. Kneading deeply comprises a direct muscle treatment. Place the thumbs on one side of the muscles and the fingers on the other. Now alternately open and close the hands, kneading the muscles between the thumbs and fingers. You can start kneading gently and gradually increase the pressure. Like kneading, friction can also be applied deeply or superficially. Friction can be used to treat localized or large areas of the body. To treat a large area, place one or both hands on the muscles with the fingers slightly bent so that the fingertips touch the skin. Now gently slide the hands back and forth, either in or against the direction of the muscle fibers. To treat a small, localized area. To treat a small, localized area, slide the bent fingers in a circular pattern over a small area, thereby displacing the skin. Start with gentle pressure and increase gradually to reach the deeper layers of muscle. Pressure can be increased by placing the fingers of one hand on top of those of the other to assist the massaging hand. Circular pressure is used to treat small, focal zones. Gently press the thumb or fingertips onto the treatment site and move with small circular movements. Increase the pressure gradually to reach the deeper tissues. Shaking is a superficial technique used to relax the muscles. A local muscle group or entire limb can be treated by shaking. Loosely grasp a muscle group or an entire limb in one or both hands and gently move back and forth and shake gently, respectively. Tap the muscles gently with the hand slightly cupped, clapping, or with the edge of the hand, hacking. Clapping should produce a hollow, clapping sound. The intensity of treatment depends on the force applied, but also on the stiffness of the wrist. When the wrist is held stiffer, the taps are harder. This is especially useful when treating large muscle groups. For passive range of motion exercises, it is essential to maintain comfort of the animal. The limb proximal to the joint is stabilized and the limb below the affected joint is grasped and gently moved. The closer the hands are placed to the joint, the lower the forces will be that are applied to the joint. Over the course of several seconds, a joint is slowly flexed until there is the first indication of discomfort. Then, over the course of several seconds, a joint is slowly extended until there is the first indication of discomfort. Under no circumstances should the animal vocalize in pain or attempt to bite. In the following section, gentle flexion and extension of the following joints is shown through their comfortable range of motion. The hock, the stifle, the hip, the carpal joint, the elbow, the shoulder. Working with cats requires more patience. However, cats do tolerate physiotherapeutic exercises very well. The hawk, the stifle, the hip, the carpal joint, the elbow, the shoulder. The limb proximal to the joint is stabilized and the limb below the affected joint is grasped and gently moved. Over the course of several seconds, a joint is slowly flexed until restriction is detected. Flexion is held for 30 to 90 seconds while continuing to gently stretch. Stretching is often combined with passive range of motion exercises in joints which have stiffness and decreased range of motion. As in the neurological examination, this reflex is produced by pinching the skin between the patient's toes. The affected limb should flex in response. The therapist should briefly apply resistance to this muscle tension. The patient is placed in a lateral recumbency and must be relaxed. Grasp the patient's foot and gently move the limb in a flowing, circular, caudal to dorsal and cranial movement. All joints of the limb should be clearly flexed and extended in the process, and exaggerated walking movements should be made. The goals of this exercise are gait patterning training and preservation or improvement of joint range of motion. This exercise can be performed similarly with the front limb and in cats as well. Weight shifting exercises should help animals regain their ability to appropriately use and place their limbs. The dog is stood squarely on firm footing. The therapist's hands are placed on the side of the dog. The dog is gently pushed from one side to the other. In severely affected dogs, some support may be necessary to avoid falling. As the animal regains proprioceptive ability, the shifts may be more challenging. Dogs with severe proprioceptive ability may be placed over a properly sized and inflated large physio roll to help provide support during weight bearing. As strength and ability return, the front half of the dog may be placed on the physio roll, allowing some weight bearing and balancing to occur. To help aid limb awareness and neuromuscular activity, rhythmic stabilization exercises may be performed by standing the dog on a properly sized physio roll and gently bouncing the dog while maintaining support to prevent falling. Animals returning to good function may be challenged by standing the dog on a properly sized Swiss ball and allowing it to bear weight while maintaining support to prevent falling. Dogs may also be placed on a balance board with either the front or hind limbs on the board. The balance board may be manipulated to rock the dogs from side to side, back and forth, or in all directions. Wheelbarrowing exercises are designed to improve use of the forelimbs. The rear limbs are lifted off the ground and the cat is moved forward. Dancing exercises are designed to improve use and strengthening of the rear limbs. The forelimbs are lifted off the ground and the cat is moved forward or backward. The shaking hand exercise actively flexes the elbow joint and conditions the muscles of the front legs. The therapist should stand in front of the animal and encourage it to shake hands using a low-calorie snack. The PT-2000 is an electrical stimulation system for TENS and NMES applications specifically designed for use in animals. This system is equipped with E-pads, brush-like needle electrode pads containing over 200 single electrodes that ensure selective, superficial, or deep stimulation without skin irritation. Since the needles of the E-pads hook into even the thickest coat, it is not necessary to clip the fur over the treatment area. The following parameters can be adjusted. With the on-off button, intensity can also be regulated. 5 preset programs are available for treatment of neck and shoulder, Program 1, spine and back, Program 2, limb muscles, Program 3, tendons and ligaments, Program 4, joints, Program 5. Individual treatment pulses can be chosen with the blue buttons: kneading pulse, percussion pulse, vibration pulse. The kneading and percussion pulse are specially recommended for muscular stimulation, while the vibration pulse should generally be used for the initial treatments. With the orange button, pulse modulation can be switched on. Varying the intensity of the amplitude keeps the treatment highly effective over a long period of time. Frequency is the number of pulses per second and only needs to be adjusted if one of the individual pulses has been chosen. The use of hot packs before actually starting the treatments is recommended. Before applying the electrodes, wet the skin in the treatment area with water or alcohol. A spray bottle is useful for this purpose in dogs, but not in cats. Part the fur and wet the skin thoroughly, not just the fur coat. Only wet the site where the electrodes are to be attached. Then slide the electrodes into the fur against the direction of fur growth. In order to treat the stifle, the electrodes should be placed medial and lateral of the joint. Secure the electrodes with the Velcro belt included in the kit. Switch on the unit and select an appropriate treatment program and pulse modulation. Adjust the intensity slowly until the animal exhibits a response. As the threshold level is just exceeded, the animal becomes slightly restless or salivates. Licking and swallowing can often be seen. Reduce the intensity until these signs subside, then immediately raise it back to just below the level where the response was noted. In this case, intensity 3. The electrodes should always be placed in a way which includes the treatment area. Treating the hip, the electrodes should be placed above and below the joint. At the hock, medial and lateral. At the shoulder, above and below the joint. At the elbow, medial and lateral. At the carpal joint, medial and lateral or dorsal and palmar is possible. For local treatment of the back and spine, the treatment should include the most painful area. The electrodes can be placed cranial and caudal of the painful area on one side of the back, longitudinal flow, or they can be placed directly on the painful area bilateral of the spine, horizontal flow. For segmental treatment of the joints, the electrodes are placed left and right of the spinal column near the nerve origins of the target region. Segmental electrode position for the treatment of the hip, L2 to S1. The stifle, L3 to S1. The hock, L4 to S1. The shoulder, C4 to C7. The elbow, C6 to TH1. The carpal joint, C7 to TH2. In order to treat the muscles, one electrode is placed on the motor point of the muscle and the other one over the muscle's insertion. Intensity and frequency should be adjusted in a way which provokes constant and strong contractions. Electrode placement for the treatment of the cranial upper hind limb muscles, the caudal upper hind limb muscles, the cranial lower hind limb muscles, the caudal lower hind limb muscles, the cranial upper front limb muscles, the caudal upper front limb muscles, the cranial lower front limb muscles, the caudal lower front limb muscles. Many cats do tolerate the electrotherapy very well if they are handled with patience and no rush. The procedure for cats is almost the same with a few exceptions. Do not use a spray bottle to wet the treatment area. Better is a wet cotton swab or gauze. Again, wet the fur against the direction of fur growth and brush in the electrodes gently, but thoroughly, so contact of the needles to the skin is secured. Many cats are more relaxed if they can sit on the therapist's or their owner's lap and even enjoy the treatment. The PT-2000 can also be rented out for home treatment, which allows a much more frequent and thus more effective use of this important method. In general, the therapist should perform the first 2 to 3 treatments, thereby explaining to the owner how to use the electrical stimulation unit, and then let the owner conduct the last treatment session under supervision. Therapists should also monitor the efficacy of home treatment regularly, depending on the underlying problem every 10 to 21 days. Extracorporeal shockwave therapy is a relatively new veterinary treatment modality. The Swiss dollar class Vet K9 is a radial shock wave unit especially developed for the use in dogs. The following parameters can be adjusted: number of shock waves applied, the frequency, the pressure. During the treatment, the animal should be placed in lateral recumbency. Before starting a treatment, the following adjustments and patient preparations are necessary. The desired number of pulses per session has to be selected. For the treatment of the hip, up to 2,000 pulses are recommended. Then set the desired frequency. In this case, it is 10 and the pressure is 2 bar. For patient preparation, clip the fur coat in the target region. Apply a suitable contact medium, for example, ultrasound coupling gel. Hold the applicator perpendicular to the skin surface and start the treatment with either the handheld or foot switch. While applying gentle pressure, move the applicator in small circles across the treatment area. Pressure is sufficient if only one marked ring is visible on the applicator. When the shock wave machine is in operation, always make sure to hold the surface of the applicator perpendicular to the skin. Do not tilt it. Using a radial shock wave unit, sedation is in general not needed, whereas, especially with focused shock wave units, heavy sedation or light anesthesia may be necessary. After treatment, hyperemia is visible in the treatment area. Other joints can be treated in a similar way. Lateral and medial treatment of the stifle and elbow. Treatment of the shoulder. Underwater therapy is another important physiotherapeutic method. This underwater treadmill offers the possibility to monitor treatment from all sides during the therapy. The treadmill should be designed so that it is not possible for the animal's toes to get caught between the walking surface and the frame of the treadmill. The depth of the water that the animal walks in should be adjustable individually. The system should have a separate heating unit with a thermostat and timer to automatically maintain the water temperature at 15 to 35 degrees centigrade. Treadmill speed should be continuously adjustable. Look for an easy way to place the animal in the treadmill. It is important that the animal gets used to underwater treatment and finally relaxes in the basin. Bicycling movements in standing position. Grasp the limb to be exercised above the hock. Lift the limb off the ground, then slowly guide it forward and backward in a circular motion, guiding the foot gently across the ground on the back swing. This gently flexes and extends all the leg joints. This exercise may be employed in animals that can confidently stand independently in water and can be conducted at various water levels with appropriate pressure applied to shift body weight. With the animal standing independently in water, gently tilt them sideways with one hand while securing it with the other. The dog must shift its weight to maintain balance. Likewise, pressure can be exerted on the dog's shoulder for weight shifting exercise. An effective method is to exert gentle pressure with one hand, gradually increase the pressure, then release the pressure suddenly. In animals with severe neurologic deficits, this exercise can be performed with just agitating the water beside, in front of and behind the animal. The animal must now work against the water current. This exercise is conducted the same as in the normal neurological examination. Stand behind the animal and raise one of its limbs off the ground, thus forcing the animal to redistribute its weight to the other side. Small dogs can be placed in the basin diagonally and allowed to hop the cross length of the basin. Give the animal time to become accustomed to the underwater treadmill. In many cases, the first session must be dedicated to playfully accustom the animal to the therapy. Playing around in the water and giving lots of praise and rewards motivates the patients and makes the later treatment sessions more effective. The treadmill speed should be adjusted to a speed being slow enough for the animal to walk calmly and in a coordinated fashion without becoming anxious or overexerted. Walking in water can be very tiring because of the additional work of overcoming water resistance. Remember that the water depth determines the amount of stabilization and weight bearing. The greater the depth of the water, the greater the degree of stabilization and the lower the amount of body weight the patient's limbs must bear. Countercurrent can be used to additionally increase resistance, leading to an increased muscle strengthening. Small breed dogs can also swim in the basin, which allows a controlled and coordinated training of the limbs like in rehabilitation of joint lesions. Keep in mind, it should be enjoyable for the animals.